Good morning, everyone. Today is Wednesday, August 20th, and we are having a single item work session here for Manatee County Board of County Commissioners. But before we begin discussing health and human services nonprofit investments, we will start with the invocation and the pledge. This morning, our invocation will be led by Commissioner Amanda Ballard, and our pledge will be led by Commissioner Mike Ron. Please rise if you're able.
Dear Lord, thank you for this day. Thank you for allowing us to come together to try to make the best decisions for our nonprofit partners in the county. Help us to be led with wisdom and help us to make decisions for the good of all our citizens. Amen.
Amen.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, and as I said, today is a single item work session. We will have public comment after we have our presentations and discussions, and it will be led by, are you leading this? All right, from Community and Veteran Services, Health and Human Services, Nonprofit Investments.
Okay, it is on.
I was
Sorry.
looking down as you sidled up, so I was about to ask who's leading it, and then you were standing there. So.
Just
Go
like
ahead.
that. Good morning, Tracy Adams, Deputy Director, Community and Veteran Services Department. And as the chair has stated, we're going to talk about our nonprofit investments. And that is a combination of oversight between Community and Veteran Services and Public Safety Department. And there we go. I think it's coming up. There we go. Okay, so there are three arteries of nonprofit funding through the county. We have children's services, health services, and adult human services. Children's and adults are administered through Community and Veteran Services, and health services through public safety. Children's services is a little different than the other two. They are funded by a dedicated millage, and so there's an ordinance, and that requires a Children's Services Advisory Board. And so to follow the ordinance, that is the main difference between the three funnels of funding, is that there's an advisory board in between us and you all. So the program areas for each of the three sections that we concentrate on for priority is under children's early care and education, food and shelter, special needs, stabilizing families and parent education, youth development and success, mental and physical health. Under adults, it's aging services, career education and employment, criminal justice, diversion, disability services, homeless prevention, with case management, legal assistance, and under public safety, health services, behavioral health care, mental and physical health, homeless and housing services. So those are the program areas that we concentrate on when we review applications for funding. So I'm going to go through this very quickly. You all know the purposes of our investments. We assist citizens in achieving independence and self-sufficiency by these programs offered through the nonprofit sector. We prevent long-term dependence on public resources, strengthening the workforce and economic stability, improve public safety, and encourage partnerships between community organizations. More can be done with collaboration. Okay, so we're going to go over what our current process is. Too many papers. So the board approves the priority areas for health and adult human services. The current priority areas were approved in May of 2023. So unfortunately, we don't have any of the new seated commissioners here today. You all voted on that.
We do have Commissioner McCann on Zoom.
Okay.
Just to let you know, he is on there. This is a work session, so we don't technically need quorum.
Yeah.
A few people did ask for Zoom links, but as last time I looked, Commissioner McCann is on.
Excellent, excellent. So the priority areas were set and approved by the board in May of 2023, and again, that was for health and human services. You also approved the priority areas for children's services. However, that comes before you with their annual plan. And the board meets at the retreat, and they develop what they would like to see as the priorities, and they do it for a 3 investment year plan. And they have, it does come before you to be voted on. So in essence, you do vote on that as well, except it's developed by the CSAB. And at some point, you should have gotten this lovely annual report, or at least a PDF version of it, which gives you all the priorities and all of the great work that the board does. So the process now for nonprofits to tap into this funding is that there's a press release and an informational meeting. So the press release announces when funding, when the application process will open, when it will close, and the date of the informational meeting. There's always an informational meeting held so that agencies can, if they're applying for the first time, they can learn about it. If they've applied 500 times, they can still attend because you can always gain new knowledge. And that happens in December. The informational meeting happens in December, and the applications open up in December and close at the end of January. So I know part of what you want to do today is to talk about maybe some possible changes with the process. So we just need you to keep in mind that if you want it effective for this next round, that we'll have to do it quite quickly because applications will go out in December. But we are paying attention to what you have to say today and what the nonprofits have to say today so we can have a direction and start coming up with some things that will meet what your expectations will be. So for health and adult human services, staff review and score the applications. And again, the scoring matrix is part of what was approved back in May of 23, looking at a variety of areas, including, the financial stability of an agency, looking at if the program has been successful, if it's an existing program. There's all of these categories. And so for health and adult human services, CVS and public safety combined review all of those applications together. And that's what goes into the recommendations. For children's services, the Children's Services Advisory Board reviews all of the application and scores them. And they have multiple meetings, and then they develop their recommendations based on their priorities and their scoring. That is also going to be presented to you. So as it stands right now, the recommendations for fiscal year 25-26 will come to you at the September 16th board meeting. However, we are having individual briefings with you to go over everything in case you have any questions as to why something wasn't recommended or something that was recommended that you might be iffy about. We can explain all of that to you prior to the day of the vote. And then there's emergency funding. So with Children's Services Advisory Board, the process for emergency funding, and again, with children, we're talking about a more robust budget because it is a millage than the other 2 areas. So an agency will notify if they have an emergency. To give you some examples of what might be an emergency and what might not be an emergency is last year we had in Rabonia their before and after school program. We had the agency that was conducting that program dissolve. So we had nothing in that area. So that would be an emergency. And we had a new agency come forward who was willing to provide services. And that was approved by you all. So that would be an emergency. A non-emergency would be, we just would like more money because we have more clients, because that happens all the time. That's not exactly an emergency. So we have to decide upon their request what would be considered an emergency and what not. So when a children's program has an emergency, it goes before the Children's Services Advisory Board. They will come up with a recommendation, negative or positive. We will bring it forward to you either way. We will also let you know if staff has a differing recommendation than the CSAB for the emergency funding, and then you will approve or not approve for the agency to get it, and then we will contract with them. For Health and Human Services, it's somewhat the same, except we don't have the advisory board. So we hear from an agency, we'll come before you and determine if you'd like us to provide emergency services. Because it's not a dedicated millage and we only have, our budgets for these two are really based on the recommendations. So there's like no additional monies for the most part if there is an emergency funding. And so we have to find the money. We have to make sure general fund, because that's where it comes from for health and adult human services, has the ability to fund an emergency request. So that's something to keep in mind also. It may be that you all decide possibly to enhance that amount that's recommended by a certain percentage in order to have some in the pot that can then go through the process a little bit faster than what it currently would go through. Okay, so as I've said, Children's Services, of course, is governed by an ordinance, and we have many members of our Children's Services Advisory Board here today. However, you are going to hear from our chair, Ms. Xtavia Bailey, and our vice chair, Ms. Janin Pierce, to go through the Children's Services part of it. And it is, the bulk of the rest of the presentation is Children's Services, just because there's so much more involved with it. Ladies?
Clicker.
Is this a test?
Good morning,
Good morning.
Chairman Cruz, Commissioner Ryan, Commissioner Ballard, and Commissioner McCann. That is
And real
on
quick, just to let
Zoom.
you- Before, since you said McCann, METV did tell me that both Commissioner Feltz and Commissioner Bearden are on. They're just not listed as panelists. That's why I couldn't see them on. But just for the public's knowledge, the three of them are all on Zoom.
Commissioner Feltz and Bearden, you said? Good morning to everyone. I am Xtavia Bailey. I am the chairman of the Children's Services Advisory Board. And you can introduce yourself, Janice.
Good morning. I'm Janin Pierce, and I'm the vice chair of the Children's Services Advisory Board.
So what we want to do is just give you a synopsis of what Children's Services and what we do. The ordinance is 91-42. Usually each member serves 3 years, and we have a Department of Children, Family, and Services. We have a judge that did family law. We have an NAACP representative, Manatee County School Board representative, criminal justice representative, a licensed mental health, a a doctor that does pediatrics, United Way representatives, and then we have 5 child advocates. And some of our child advocates, they usually have experience in different areas. The applications have recently closed for the vacant of the expiring CSAB member seats for 2026. Children's Services Advisory Board attending expectations. So during the current fiscal year, there were 22 various meetings scheduled for the CSAB. Out of the 22 meetings does not include the subcommittee meetings or Board of County Commission meetings. All CSAB meetings, including the annual retreat, subcommittee meetings, regular meetings, review meetings, and recommendation meetings, are publicly noticed on the county calendar. Members with 3 unexcused absences may be terminated by the CSAB board. Children's Services Advisory Board responsibilities. CSAB learns about and understands not-for-profit programs providing services for Manatee County children families. The CSAB reviews and discusses data for the variety of sources from local, state, and federal levels. So what we really try to do is make sure that when we are coming up with the priorities and we bring them to you, we are listening to the community. Everyone that's appointed by you all, we are advocates in the community, no matter who we are. So we always have people coming up to us, and we try to bring that information back to the board. We determine those priorities and those targets. We provide input and review Manatee County Children's Services annual report. The final annual report is reviewed and approved by Manatee County Board you all, reviewing and scoring annual applications for the investments. Really quick, I want to talk about the scoring and investments, and just to make sure, we try to make sure we do this the best way so we can be fair to all the nonprofits. That is the scoring process. So we really just go through every single year and we rescore everyone. They can resubmit, add, they can request for more money. And what we've done is really tune in to make sure that even if they're asking for a request, there's a process on our board for every single thing. And Commissioner Ballard is nodding her head because she's there. She's also there. The CSAB determines and recommends children's services at the end of our review sessions, program investments to you all. Our priorities for 26-28. Children are safe in their homes, free from abuse or neglect. Children remain in their homes, free from abuse and neglect, avoiding the need to re-enter into foster care. Children who enter foster care gain a permanent, stable, and nurturing home within 12 months and remain there. 25-26 priorities. The next few slides show the priorities for the children's services in Manatee County, determine the CSAB, and this is included in the annual report that was approved by you in December of 2024. Priority B focuses on literacy at all ages with a goal to reduce the gap towards age developmentally appropriate literacy skills and maintain age developmentally appropriate literacy skills. Slide 1 of 2, priority 6. This one focuses on mental health and behaviors of children, providing education and direction and support. 1 of 2, priority C, focuses on the mental health of behaviors of children, providing education. Priority D is the newest priority and very important for the safety of the county's youngest and most vulnerable children. This is where the Sleep Baby Safety Initiative will make gains in reducing preventable child deaths along with the drowning prevention efforts. It is not necessary for a program to meet or recognize a priority when applying for the investment. Annual Children's Services recommendations include programs and services that don't meet a recognized priority and fall into these categories. Meaning we set the priorities because these are what we're looking for, because this is what our county, these are the needs in the county, but they do not need to fall in the priority. They can serve children and they can still apply. Commissioner Ron, you have a question before I move?
Yes, ma'am.
Yes.
Do the priorities get weighted heavily, more heavily than non-priority when you guys are grading?
What do you mean?
It's one of the A, B, or C priorities, does it get weighted more heavier than, say, food and shelter does when that application comes in?
They're not getting weighted.
Did you hear my question?
Go ahead, Janice.
My question is that does the priority services, which are A, B, and C, do they get weighted more heavily in the grading system than if it was a food and shelter type application? Is there more weight given to those?
The advantage to being within the priority is that you get funding, you get evaluated for funding first.
Okay.
So when we score them, we go through and have our scores, and when we do our review, we review the priorities first. In terms of the weight, so we start with, we know this program is in priority or not in priority, and so that's throughout the application because they have to choose a priority. We don't choose it for them. So it's not so much of a weighted advantage other than when it comes to funding. For example, when we're limited in funding, we fund our priority programs first.
All right, thank you.
I will just add really
Yeah.
quickly, our nonprofits really try to make sure that they meet priorities.
Yes.
Sometimes they
Don't.
shift their applications a little bit to try to meet those priorities, but that the advisory board still looks carefully at those and makes sure that they're actually meeting the priority versus just trying to tailor their application in a way that it's not actually meeting the priority.
And we have some programs in our non-priority that are absolutely critical for our community. For example, ELCs, the children that are getting discounted childcare based on their,
Match.
I'm sorry?
We do matches.
Yeah. So there are some programs like that, our families can't afford childcare unless they get that from the ELC, that service from the ELC. So when you think about what those priorities were, it doesn't cover all the things that still are so key to our community.
And I just want to say thank you, Commissioner Ron, for asking that question, because I've been on the board when we didn't have the money and we had to do cuts of about 7%, I think it was, Debbie. And so we had to choose priority over, and then cut 7% for the programs that were not priority. So when you do meet the priority, you're going to be considered for funding first. That's how we do it. Any other questions? Thank you.
Good morning, James Crutchfield, Deputy Director of Public Safety. Over the next 3 slides, I have the ability or the responsibility to highlight health services. Again, just to recap, health services is underneath public safety. That team provides healthcare access through planning, healthy living initiatives, and some contract funding. Health Services team also manages the county's indigent health program, low-income pool funding, and again, like Tracy was saying, operates in the same framework that was approved by the board, holding informational sessions, and scoring applications based off of the priorities set forth by the board. I do just want to kind of provide additional insight, because we were just in children's services for the last few minutes, to highlight some of the differences between children's services and health and human services. The application itself has 100 possible points, and the threshold for consider funding for you all is 80. Again, that was set forth in 2023. There's some modifiers in there. The applicant can get some additional score or additional points based off meeting priority areas, impact, and previous performance. For FY26, the team reviewed there were 6 reviewers from CVS and Public Safety, and the county's grants team, I think, might have reviewed a couple. Just to recap, some of the funding priority areas for the health and human services are inpatient, outpatient substance use disorder, homelessness prevention and case management services, outreach services to include remote medical assistance, dental services, and peer recovery services. All of those priorities are funded through the county's general fund. Currently, the health services team is managing 14 nonprofit agreements. That management looks like technical visits, maintaining compliance with deliverables, monitoring outcomes, and performance tracking. It's important to note here that out of those 14 programs that are funded, that excludes all opioid-related funds and also any emergency funds that were approved by the board throughout the funding period. Again, about 67% of this year's contracts are healthcare, 20% is homeless and housing initiatives, and 13% is behavioral health initiatives. We received 21 applications last year and provided 14 through recommended funding. For 25-26, the division or the Department of Public Safety is recommending 18 programs to be funded at a total of 2.6. It was about a 49% increase in requested fundings from the previous year. However, there was only one additional program that applied. So last year there was 21 applicants. This year there was 22. After the scoring, again, what's going to come in front of you all is recommendations based off that threshold of 80 points. And then, like Tracy had mentioned earlier, we'll do private briefings to make sure that you guys are all well informed on how the scoring broke down and why certain programs are recommended and certain programs are not. This slide really details the core services that the health division is focusing on. You know, I like to break things into buckets or into something that's a little bit easier to digest. So we have behavioral health programs, which there are 7 that will be recommended for funding. Those funding programs predominantly focuses on delivering critical unmet needs in the community, such as substance abuse services, Marchman Act, Baker Act services, inpatient detox services, family support, and the broader mental health programs that are in the community. For healthcare programs, there's 4 that was requested and 4 recommended. Those are to address critical gaps for indigent resources, mobile services, and to provide health resources to the underserved individuals in our community. For homeless and housing, there's 7 recommended programs. Again, this is predominantly wraparound services, homeless prevention, diversion programs, and outreach support, along with some housing stability resources for those individuals. With that, that is all for health services. I'm happy to answer questions, or we can wait till the end.
I'm kind of being flexible here, so if someone has questions, by all means, I'm not even looking at the screen.
Yeah, hey, good morning, Deputy Director. Quick question for you on indigent care funding here in Manatee County. We know that the hospitals, the public or private hospitals are required by the state to take indigent care, but we also have Manatee County Rural Health. Indigent care is ever increasing in our community. How do we, if we need more funding for that, is it a request that you guys come to the board and say, hey, we need more funding, or is there another bucket we can pull from, federal or state grants or something of that nature that we can pull? Rather than just come and say, hey, guys, give us more money for this, is there anywhere else we can go for that?
So it's complicated would be the easiest way for me to explain that.
Okay?
Yeah. The county does.
Make it uncomplicated.
Okay, I'll do my best. And, you know, I feel a little bit more comfortable because this is a work session and we can dialogue back and forth a little bit. So the county does invest in indigent health care. They provide low-income pool funding. So low-income pool funding is a resource where the county does an intergovernment transfer to the state, and it's matched for a 2-for-1. So, for instance, we provide funding to MCR in a low-income pool arena where it provides compensation for uncompensated care. It did get tricky providing nonprofit funding to for-profit institutions. Over the last 2 years, the county attorney's office provided us a memorandum saying that certain benchmarks had to be met for that funding to be passed through to them. So when you're talking about some of the hospitals, they were unable, or at the time, unable to produce the data points that we need to meet the requirements set forth by that contract that the county had to execute. Does that answer your question, or?
I'm more confused than I was when I started, but that's
Okay.
Could I,
As far as other grant opportunities, I would say that, you know, the county has a grants team, and, you know, we do try to do pass-through grant funding once it's eligible, or if we're able to get awarded a grant. But if you're asking for additional fees for uncompensated care, you know, all of those services are funded through the county's general fund.
okay.
We did transfer last year more of a fee-for-service model, which means that if you meet eligibility requirements to be a part of the county's indigent health plan, meaning that you're below a certain income level, you are a county resident, you're not eligible for other marketplace insurance providers, the county will enroll you and case manage you through the community health team and make sure that you're getting the care that's medically appropriate at the most economical price that the county can pay. So if that is getting a colonoscopy at the hospital or at MCR because there's a community provider that's not able to do that outpatient, then the county would reimburse at a Medicare rate for that service.
All right,
May I make two clarifications too, Commissioner? One is Manatee We Care. I think there were some misconceptions last year that it went away. It has not gone away. We're using this for that fee-for-service model. That's where that money is going. Last year, some of that money also went to MCR when we found out that Manatee Memorial was cutting some services that they wrote a letter on that. The other piece is EMTALA is a federal requirement for hospitals to have to treat emergent patients, at least see them. So if someone that's uninsured or underinsured goes to the ER and says, my stomach hurts, EMTALA federal law requires that they be seen first. They can't turn them away. Or if it's an emergent condition, that they are treated at the hospital. So that's something that is the requirement. It's not the state, but it's EMTALA is what requires that.
all right. Thank you, Deputy Director.
So just a couple of questions. So are we talking, so in this entire discussion right now, when we're talking funding, are we just talking about low-income pool funding? Or are we also talking about grants
So the low-income,
from the county?
yeah, so the low-income pool funding is separate from this discussion. So that money is requested through the budget process. The state provides projections on what they think the multiplier will be, and we ask through the budget process for that money to do an intergovernment transfer.
Okay. And so aside from the low-income pool funding, actually, where does the low-income pool funding go? Does that go to We Care? Does that go to our indigent health program?
Yeah. So it goes to Manatee County Rural Health, MCR, and Centerstone.
Okay.
Manatee Memorial was participating, but they elected to tax themselves, so they have a different structure now, so we don't provide funding directly to them.
Okay. And so currently, how much are we spending on our indigent health program? And that's the six-month program, right? I'm sorry,
2.5.
Jenny.
I'm just going to ask two to come up here, because
Okay.
I think it's 2.5, but I don't want to misspeak.
And that indigent health funding comes out of the general fund, right?
Yes.
Okay.
Good morning, Julie. So this year, I think when I looked at it a couple of weeks ago, we have about 5-6 spent so far. The providers have until September to continue providing services for this fiscal year, but then they have until December to submit all their claims.
Okay. And so when we're enrolling people into the indigent health program, that's meant to be a six-month program, and you're trying to give them kind of a chance to get on to a marketplace health program, Medicaid, Medicare, whatever they're eligible for. Is that right? The county's kind of filling that gap in the interim. Is that correct?
Yes, yep.
Okay. So my next question is, you mentioned the requirements for people to participate. Are people who are not legally in the country eligible to be part of that program?
So right now, there's a legal opinion, and I think CVS submitted it. I don't know if Tracy can maybe speak to that. There was a request for legal services to kind of add that language into the boilerplate.
Okay.
That is correct. So this is the year that our template, nonprofit template, is reviewed, because it's reviewed every 3 years. And so we took the opportunity to develop some language in regards to that, and the county attorney's office is currently reviewing it to see if we can make it as a part of our template, or at least something that the agencies have to sign off on, that they're following that.
Okay. I think those are my only questions for now. Thank you.
Hold on, what was going to be in our template? That was very vague. Didn't actually answer.
The status of individuals being provided service to. So the clients of the agencies that nonprofit funding goes to, their status as far as their immigrant status. Are they illegal or legal? What threshold do we have the ability, without breaking the law, to require that the funding is spent on? So
I also want to add a piece to this too, is that, if the RLS comes back and we can add this language in, we have to also be mindful of the nonprofit's ability to report this data. And that's something that we've struggled with in the past when we are racking and stacking an application from a nonprofit. So they will be responsible for reporting this data if it's in the nonprofit agreement. So just, those are things that we have to be mindful of as we update the nonprofit.
So this is going to come back in front of us for discussion.
Oh, yes.
right?
Yes.
Okay.
yes, yes, it will. It will come back in front. The language we chose, just to give some background, because where do you start, right, to develop that language? So in CVS, in our aging services section, we have a state and federally funded electric assistance program, and that application has a statement. So that's where we started.
Okay. It's outside the scope of this conversation, so I'm sure we'll have that conversation later. It probably would be calmer with the current makeup of the attendee board, but I'm still ready to discuss whether or not transmittable diseases go across people regardless of their citizen status. But anyway, my question's relative to this, a couple things. One, do we anticipate an adjustment in where we're focusing attention on funds once Baycare comes in, once we have a nonprofit hospital?
I think the short answer would be yes. I think that board priorities should adjust every 2 years, because ideally, the initiatives that you guys set makes the community healthier, right? So we should always be adjusting and setting new priorities and maybe shifting our focus. We have been meeting with Baycare. We meet quarterly with their leadership team. They are planning to open up like a health hub first of this next year, and then the hospital in 27, I believe.
Okay, second question. One of your numbers on this, it's now gone over. You had 3 buckets of money. The largest one on here is homeless and housing. I personally think homeless and housing is the most important thing, and I think everyone knows that. But why is that coming out of here? I mean, it seems like there's lots of grant money for lots of things and lots of buckets for housing. It seems like we're using a disproportionate share of healthcare funds for something that has other funding sources.
So that would be a priority that you guys could direct us to change. I mean, I will just share with you that we're talking about determinants of health. And, if you look at things that are downstream, I would say that someone who has access to services, whether it's housing or other wraparound services that homeless individuals need, definitely impacts their overall
I
healthy state.
100% agree with that sentence. I'm not even refuting that or going to argue that. I think putting a roof over someone's head is the best health care you can give somebody, but I'm questioning whether or not putting that roof over their head should come out of a bucket that should be catering to people that are sick and not the preventive side relative to housing, which we've got SHIP funds and sale funds, and we've got housing stuff, and we've got catalytic loans, and we've got everything else under the sun for housing. It seems like that's $1 million that maybe could be better spent, since we could probably find that $1 million to our grant
To a
writers.
different funding source.
My opinion. Last question, because we talked about Manatee Memorial versus other alternatives. I feel like there's other people that maybe don't get as much money, and again, goes to priorities, but we're having a conversation. It almost feels to me like prevention is way more important than taking care of people. Like, I feel like you could take care of 100 people with Dayquil for having a cold before you take care of one person with a pneumonia because they intentionally waited till they got a pneumonia to show up at the ER. Because then it's free, because now all of a sudden it's injured in healthcare. And Manatee Memorial then says, hey, wait a minute, I'm treating this guy and I'm stuck treating him. You got to give me money. Meanwhile, I got Turning Points and MCR sitting over here like, I'll give you some free Dayquil right now. Just give me $5 and I'll take care of this person. Instead, we're being asked for $20,000 to treat somebody with a serious problem down the road. Like, shouldn't our attention be on the nonprofit side that's handling the prevention? And in the long run, wouldn't that trend upstream on a funnel to actually save Manatee Memorial money in the long run because of less people showing up because we've treated them where they should be treated with taxpayer money?
Yes.
Okay, thank you. Fair enough. Okay.
Yeah. So, I mean, you're talking about a system of care, and, I think sometimes we get narrowly focused on getting a quick result. And, sometimes it is uncomfortable to just wait and invest and make sure the system is established to get the better, more economical results. I agree with what you were saying.
Okay. That was it. That was more of a statement than a question. All right.
Okay.
Thank you.
Yep.
Good morning again. So the nonprofit for the Adult Human Services is again administered through CVS, and the managers of those agreements do the same oversight as what Jimmy had stated. Make sure that they're in compliance with the agreement, they're doing what they said they would do, they're in agreement, or they're following what type of insurance they need to have, that they're submitting quarterly reports on time. So it's just the overall oversight and the due diligence that the agencies are doing what they have agreed to do. So this year that we're currently in, there was $663,196 approved. We had our funded 14 programs through these funds, and the breakout is aging and long-term care, workforce development and housing stability, and legal services and system supports. And that's where we're currently at. This is what we're getting ready to wrap up for the year. And then for 25-26, we in fact did not have $6.4 million requested. That is incorrect. We had $981,168 requested. We received 16 applications, and we're going to be recommending 14 programs at $761,168, so about $100,000 more than what we invested last year. And just to let you know, like the aging services, that is, Myakka Community Center does a super senior special people program out there, so that would be considered aging services. Meals on Wheels has adult daycare, that would be considered aging services. And then for disability, we have Easter Seals, their adult day training. One of the things you'll see, especially when you have your briefings, is that you'll see the same agency that we're recommending funding under Children's. We're also recommending funding under Adult Human Services because they're just completely different programming. So we are cognizant and try to make sure that we're not, even all the other funding that flows through our department, such as the HUD funding that comes in, and we have some nonprofit agreements through that we're not duplicating. We try very hard not to duplicate. If they're already receiving funding for a service, and then they try to, through HUD, one of our HUD grants, and then they apply for the same program through through our nonprofit funding arena, we try not to overlap so we can spread the dollar as far as possible. So these recommendations is what we will do our briefings on with you. And again, we received 16 applications and are recommending 14 programs out of those 16 for funding. And any questions about that before we go on to the wrap-up of next steps?
I can't see Zoom, so I can't tell. So if you're on Zoom and you work here, just chime in because I can't see. Sounds like no.
So, of course, as we've said, and we're repeating again, you will have individual briefings on the recommended investments. They actually start on Monday, and it will be all three arenas at the same time. So have your caffeine or whatever it is that wakes you up. And then on September 16th, that is when we will come before you for approval of the recommended investments. And I'm I'm going to hop back to that in 1 second, but then these agreements are effective 10/1/25. So although they might not all get fully executed because it's a short turnaround from when you make the final recommendation approval to when the contracts start, they are effective 10/1, even if they get signed 10/25. And the effective date of services is 10/1. For the approval of investments at the September 16th meeting, it's going to be one big agenda item with many motions to approve each area's recommendations or not. But at that time, you can also make a motion if you want to add emergency funding dollars to the health and adult human services. You can make a motion to direct staff to come back with something new or different or improved in regards to the process to start the next investment year, not this investment year. It's all but said and done.
Can I just make a suggestion? Obviously, they're volunteers, so it's at their ability, but children's services is such a disproportionately large and complicated part of this, where they spend all year doing it. And sometimes in years past, we've had briefings, and we have questions, and all the answers are, we'll find out, because children's services doesn't have a representative there in our briefing. And that always becomes one of the bigger conversations up here. It's one of the bigger presentations. It's a big thing. Is there a way we can at least ask? I know they're sitting behind you, but I mean,
I don't mind.
can I ask either just have that as a separate briefing and have a representative like Xtavia or Janet or somebody from Children's Services there, or even if it's within the same briefing, at least have them there for that part at their time availability. Of course, they have other jobs, but I think that would help because they put a lot of effort into this, and there's usually a lot of questions to it, and we usually don't get answers because they're not there.
Right, yes, we most certainly can put it out to the advisory board, and it may not be the same person for each briefing, but they all have the same knowledge and the same information.
Or even see, maybe if there's a day that Xtavia or somebody else representing is available, we can do what we do with, like, say, the EDC, and have them stay in a room on the 5th floor and kind of speed date commissioners do on 30-minute intervals just for children's services, so that they don't have to bounce from room to room and adjust around schedules. Just say like that Monday is children's services. If you're a commissioner and you have questions and you want a briefing specific with them, this is your time slot, and that, we can buy them some pizza or something.
We can do that. Yes, sir.
Any other questions, comments? Nope. If not, we can still talk. I want to open up the public comments. So if you want to think.
Real quick, every year when you guys come through, and they do a great job, and thank you for volunteering for this much-needed services advisory board. I know it's not easy going through the list and say, yeah, this one is great, and there's 2-point difference, but we got to choose this one. So I know it's a very difficult process you guys go through. But it seems like every year that we do this, that when you guys come for the board and you say, here's the one we want to fund, another agency steps up and says, well, we need 100,000, can you guys help us? And the board will go through that process of debating that. I'm just trying to get ahead of that process, that, somebody comes up and says, hey, I need this money, and then the board, we all have a discussion about it, and then we vote outside of what the committee says is a great, these are our recommendations, and then we do one outside of that. Is there a B list? I mean, using saying like, these are the A list, but here's a B list, and these are guys we really wanted to fund, but we couldn't find funding for the board, maybe, or maybe we do that in our briefing.
We can do that we usually do that in the briefing. If you're talking specifically about children's services, you will see everything. You will see even what was not recommended, and we can answer why. For agencies that might come forward who didn't go through the application process, I don't know what to do about that, other than say, try next time. So you'll see everything that was applied for and what was recommended and what was not. So you'll have the knowledge by the time the briefings end of why we didn't. So if an agency does come up to speak on behalf of themselves,
or any of the funding, or any of our, be it health services
Yeah.
or whatever.
Yes, sir.
You know, because like we had to help out, you know, our daily bread. We had to just jump in and help out our daily bread because they had a major request because they didn't fit, they couldn't get all their data in the right boxes at the right time. And then we had to come in and help our daily bread with a significant funding so they could keep operating. And, you know, and I know we've coached them better and they're going to do their thing. But I'm just trying to get to, do we have like a B list that says, through all the CVS, through all the, you know, CVS needs and whatnot? I mean,
That's true, yeah. I guess it would be by score, those that
okay,
weren't
all right.
recommended.
Okay, I'm just trying
They
to
still
think
have a
that process through the
score.
conversation, so,
Yeah.
for myself, because we always seem to have, when you guys make this presentation, there's a line out the door that didn't meet the, you know, the 2 points difference, and I need the funding, and they're in here going, hey, we need help, we need help, we need help, and then we sit here and have to analyze that, go through that process, so I know here's our A funding, here's our B guys, and these guys aren't gonna make a list, so they didn't make the list. So I'm just spitballing with you guys about the process.
And I think that it's important, just kind of re-mention, Tracy said it earlier about emergency funding, but there is no pot of money for emergency funding. So, I mean, that would be something that I would request that is a policy statement or set aside, whether that's like a certain percentage of the allocated amount for health and human services, 5%, 10%, 1%, whatever it is. Like, it's, when agencies come in front of you all, there's no money inside of CVS or public safety for that to come from, which creates, you know, some workflow issues and delays addressing the true emergency need that they're coming in front of you for. A budget amendment has to take place, and, you know, there's just like a process of things that have to happen. And I don't know, I mean, I don't know how to fix that other than a set aside.
Okay, all right, I'm just trying to come up with a smoother way for the process to move forward, and that happens, and it always does, you know, I
So-
mean, you know, it just comes out of general fund, so I mean, we have to figure out, is there a process other than the board just debating on that, if that's a worthy cause and how much we're gonna give them and that type of stuff, so just trying to make the process a little smoother and moves a little quicker than we've experienced in the past. But thank you for your answer, I appreciate your response, thank you.
So I think what you're suggesting is that we have a set aside for emergency funding, you know, of, let's say it's, you know, $500,000 that is open, that we know is available if there are emergency needs from a nonprofit in the community. That way you're not going through the process of trying to find that funding out of the general fund.
That is correct.
Okay.
And of course, we'd come before you with that request from the agency to
And then-
determine if
and
it's a
then we
true
know-
emergency.
We know on the front end, look, we have emergency funding available for these types of scenarios. We know how much we have, and, you know, it's set aside for that purpose. Another thought that I have is, you were mentioning kind of the A list and the B list. I mean, I think the A list is the organizations that meet the threshold. The B list is the ones that don't, and the others are the ones that we just have no data on because they didn't apply. Is that correct?
Correct, or they did apply and they failed to to qualify.
Or meet the minimum qualifications.
Meet the minimum qualifications. Just to backtrack just a little bit, so any agency that has a program for emergency funding, if we do get this set aside, which I hope we do, it will make things smoother, they still have to comply with what is required in our nonprofit agreement process. We don't have anything separate from that to just assist. They still have to comply with everything that is in the application process.
Understood. So even if we approve someone on an emergency basis, they then contract with us and still have to complete all the requirements that any other funded nonprofit would comply with.
That is correct.
Okay, and then if I could ask another question just about the review process and the fact that it's really all on staff right now, and so, you kind of take the slings and arrows for what's funded and what's not. That's a little different than Children's Services, and we have a group of citizens that works on it. Would you all be open or welcoming of a review group to assist with this type of thing?
Yes,
Okay,
it would be very helpful.
okay. All right, those are my questions for now. Thank you.
That, we're likely going to be, we talked about this yesterday, we're probably going to, sorry, Chair, I was going to add my staff, but we were going to come before the board in March or April, that's what I talked to with Sarah before she went on leave. I think it's probably going to be now, sooner rather than later, because there's a lot of stuff that we need to put in place by November for the new application cycle to open. So we'll probably be coming before you pretty soon to ask for some direction on that.
All right, yeah, just comment on some of these things, and then we can go to public comment. Yeah, the question was, how do we work on the process relative to B lists and emergency? I think the problem is we have a process. What you're asking is how do we work around the existing process for our own benefit? Like, we have a process. And the problem is every year someone tries to break the process. Every year Children's Services comes in, it's like, here's $14 million worth of funding. It's like, oh, take those two out and put this one in because this guy called me yesterday. That's the opposite of process. That defeats the purpose of the process. Like, at the end of the day, we need to remember two things here. One, we're using taxpayer money, not our money. And two, this is a zero-sum game. Unless we increase the bucket with other taxpayer money, it's a finite amount of money. We just had this conversation with the opioid thing, and the question wasn't like whose priority, it's how big was the bucket. But at the end of the day, if you say, I deserve $50,000, and I'm not pointing at anyone, I'm just going over here, then that means I have to take $50,000 away from somebody else. And nobody up here is smart enough to understand who's going to best use that $50,000. We have smart people deciding that, and they're supposed to tell us that. So if you want to fix a process, you need to fix who it's going to. Like, here's some of my problems I've had, and I'm not pointing anybody out, it's just reality. Because you say B list. First off, like, the B list is who's the 65th team in college basketball who didn't make the March Madness? Who's the 13th team in the college football playoff? Like, you can argue that all day long, but you're not arguing who's the second best team, you're arguing who's the 65th best team and whether or not that's better than the 64th. I think we need to look at how we're funding things, because sometimes I see people, and they could be the greatest nonprofit in the world, and 10 years from now, they're going to be on the cover of Nonprofit Weekly. But today, they just started, and they're looking to us to use taxpayer money as effectively seed funding incubators for what sometimes equates to 100% of their budget for the year. Like, that's tough, and we respect it, and I love those people. And they have big hearts, and they're helping somebody, and that somebody's the one who inevitably comes here and tells us about how they were helped. But we need to come up with a better system here, because we need our nonprofits because of zero sum. If I can give you all 100% of your budget every day, and it's my money, I would do it in a heartbeat. But I don't have that kind of money, and I don't have that authority to do it. We need to come up with a better system here, because I'd rather structure this around matching of some kind where it's like 25-75, 50-50, 90-10. I don't even care what the number is, but some implication that if we're investing communities' money via their taxes, that the community also cares. And you can prove that by going to the giving challenges and having yourself a fundraiser and doing whatever. And you see those all over. And inevitably people say, you're only funding the big people. Guess what? The big people are the ones having the fundraisers. The big people are the ones on giving challenges. The big people are the ones having, sangria showdowns and black tie events. And they're doing things. And they're out raising their own money and having their own boards. And then they're coming and we're supplementing them. Mm-hmm. And the community's already shown that they're behind that nonprofit. But then we get other people coming in, it's like, hey, I just started up last week, can I have $100,000? And if we don't give it to them, we get yelled at for it. But if I take that 100,000, it's 100,000 from somebody else. So I think there just needs to be a better system to make sure, again, it's an equitable distribution of where the taxpayers really want their money to go. Because as soon as we step away from the process, we've stepped into politics. That's inevitably true. You can look at all these things. Emergency funding is different. That's not a B. Sometimes emergency funding goes to someone who's already funded the first time, but there was an issue with the giving challenge. There was an issue with grants not coming down from the state. I mean, there's extraordinary circumstances. Extraordinary circumstances isn't, this friend of mine is starting up a nonprofit, we have $100,000 for him, and we just peel off a couple of bills from the budget and pass it on. That's not emergency funding, that's politics. And that's not best use of taxpayer dollars. So I think we need to be more thoughtful about how we spend it. I'm not saying spend less, I'd spend more if the board wants to spend more, but we need to be more thoughtful about how we do it, because I'd rather sprinkle the money across people who have community support in a broader way with that finite pool of money than play this game where we're funding 100% of people's budgets that I approve, because I don't want to fund it once. Someone said that about something else the other day. Like, what if we do it every other year? Well, because then every other year, half of them are going to fail because they're relying on recurring funding to work until they can become self-sufficient. I'd rather them to prove their self-sufficiency up front and then give them something more recurring that they can rely upon to hire that extra person or buy that extra van or whatever it is. So I think that's what we need to be working on, not how to come up with the 65th best nonprofit, but how to be more thoughtful about the nonprofits we have that are where the taxpayers actually want their money to go.
I have a question.
Go ahead.
If you're done and
I'm
finished,
done.
Chairman.
I'm done.
Hello?
Yeah, you're good.
Okay, awesome. So I completely agree with Chairman Cruz on this. I think the main thing is that we need to look at, which I've had these conversations, is a key word here. We need to define financial stability. Okay? Does financial stability mean that I'm getting 50% from the federal government, 25% from the state government, and 25% from the local government? I don't think that's that would be an organization that, in my opinion, would be financially stable, especially from a local standpoint. And I don't think that if they are getting majority funded from those organizations, is the community really behind this particular nonprofit? Right. And I'm going to the extreme because, I'm looking at it from a broader perspective. I think when we look at financial stability, I think we need to have a metric that's put in place of one, individual donors, right? How much of the percentage of their budget is coming from actual individual donors? The second thing that we can look at is, which would be, more of the business community, but maybe corporate sponsorships. How many of, corporate companies are getting behind these organizations as well? We also may need to look at the grants. How much in percentage are they getting in grants? And as you said, Chairman, the events and the campaigns. Are these organizations that are out there, are they doing, the Giving Challenge? Are they out there running a gala? Are they out there doing these certain things and having that measurement approach and saying, okay, because if you do have let's just say you have a smaller nonprofit, which I know of some that are out there that may only be pulling maybe $200,000 a year, but they're making a major impact in our community. But they're 100% private donor funded, right? And they're skimming the line every single year. They haven't got any grants. They haven't got any, any type of, federal funding or state funding. They are completely 100% donor based. That's a type of organizations that we need to look at to say, hey, you might be a smaller organization, but guess what? You are doing your part. And because you're doing your part, we want to get behind you as well, as a community, as a county, right? In my opinion, whether they be large nonprofits or small nonprofits. I want to see, as you said, Chairman Cruz, I want to see the work that they're putting in on their end, right? Because at the end of the day, if we're constantly funding these organizations, what I mean, they're just depending on us. We become, you know, a well that they just keep coming back to and getting more and more funding from, but they're not doing their part. And so that's just my thought on this process. And if they're only running, I mean, is their donor base increasing year after year? And if they're decreasing, why is that donor base decreasing? You know, there's other several factors, but these are the types of things that I think we as a county need to look into, because you know I am looking at the part of financial stability, right, at all times. So, and we need to be able to define that. That's all I have, Mr. Chair. Thank you.
There you go. You found something that myself and Commissioner Beard 100% agree. All right, if there's no more comments, I will open this up for public comment. I have two names. I have Kara and Dr. Price. After that, it is open season on the mic, so. What's that?
Good morning, Commissioners.
State your name, county of residence. You have 3 minutes.
Dr. Melvin Price, CEO, MCR Health, Manatee County residents. I'm here to just to give you a little bit of further insight onto MCR and our emergency room diversion program that we've instituted and a little bit of its impact. We believe that this ERD program, emergency room diversion, provides a cost-effective care to uninsured residents, preventing unnecessary emergency room visits. We can demonstrate for every dollar invested by the county, it saves $5 in medical expenses to the taxpayers and to the actual recipient or patient that we would see. This program strengthens the community while reducing the burden on the hospitals in the area. We actually processed about 3,900 applications by our certified application counselors over the past year. Over 50% of those came from our emergency room diversion program. And those patients that were not converted, and I mean converted to Good County, we were able to put those patients into the marketplace or into Medicaid, so they wouldn't have to go to Good County for their care. We served over 20,000 patients in Bradenton, Manatee, and Southeast, which was the 3 sites which we have our emergency room diversion. And of those, about 7,000 were uninsured patients. We have anecdotal stories over and over on patients that could have gone to the emergency room and did not because they were able to go to our walk-in sites, the 3 locations that I mentioned. And we are partners with the local hospitals, Manatee and Blake alike, to make sure that the patients get to the right point of care for the condition that they have. And then I believe that this is an ask, but the need of this emergency room diversion is going to be ever increasing. We anticipate looking forward that as the marketplace, people become ineligible for marketplace and people get cut from Medicaid, they will shift to the uninsured bucket. So this need is only going to be a growing need going forward.
Good morning, Commissioners. I'm Kara Honorato, and I have served as MCR's Chief Financial Officer since May. Like you guys, I spent half of my career in government, and especially at the county level, so I know you have difficult decisions to make on who gets funding and who doesn't. And to Commissioner Cruz's point, you are taking money from one based on your decision to give money to another, and I totally understand that. I do want to speak to you today about ERD, like Dr. Price has mentioned. I'm coming here as your CFO, as the CFO of MCR, but I'm also coming here as a daughter of a mother who is a diabetic amputee, who is on Medicaid and Medicare with very complex health needs, and also as a mother who knows firsthand how access to care can change everything. You heard from Dr. Price about the statistics, around the number of patients that we've served. But to boil it down just a little bit more, I think this is one of the very smart investments that this county commissioning board can make in its community. And other statistics around what is happening at MCR, I don't know if you are aware, but if you are uninsured and when you come to visit us, it'll cost you $128 for that visit. But if you go to the ER as an uninsured patient, that's $815 out of your pocket, okay? Then that's even before you have tests and medications. And during the funding period of this year, we did see that Manatee County residents doubled in numbers coming through our emergency room diversion program. And they were all brand-new patients. So we're clearly meeting the need in the community. The other point I want to make here is I understand, and you can correct me if I'm wrong, again, am I only been here since May as the CFO of MCR, I'm brand new to this community in its entirety, and the state of Florida in its entirety. So if I misspeak, please feel free to correct me. But I understand that the county has a program where it makes funds available to pay for EMS services for people that meet a certain income criteria. Is that correct? And I believe that's about $750 per ride, if I have my information correct. So of the 7,400 uninsured patients and Medicaid patients that we saw, they would meet those eligibility requirements, correct, if that is the 200% of poverty level. At $750 per ride, if only half of them take an ambulance and meet the requirements to be funded out of the county, you've more than paid for the $1.3 million investment that you invested last year in MCR. Simply put, every dollar that gets invested, the patients will save $5, but the county actually saves $2. So you're doubling your investment with us. On top of that, we do absorb a majority of the $36 million that was spent annually in uncompensated care by MCR. We receive about $9.7 million annually from the federal government in what is called 330 funds that we get for just being a federally qualified health center. In addition to that, we receive $1 million in other grants and about $2 to $3 million in the low-income pool, which you've discussed. And that's still less than a quarter of what it takes to cover the true cost of care. You were not giving us both individually 3 minutes? or
You
just
did
3
get a
minutes?
whole 3 minutes.
I did get
And
the whole-
another minute. so
I
you're
get
up
a
to
whole 3
4.
minutes?
The beep wasn't halftime. That was,
Sorry.
I was giving you flexibility. We do appreciate it, but you've also been pretty good about trying to go around and briefing everyone. So a lot of what you're saying, while it's important to the public, has been heard from the board as well.
All right, well,
All right,
thank you.
thank you.
Thank you.
Bye.
Good morning, Kathleen Kramer, Manatee County resident, Executive Director of Turning Points. I wanted to go back to talking about measuring financial stability of nonprofits. And I am not in disagreement, but I want to caution you to really think through the plan, because what I'm hearing would eliminate Turning Points, would eliminate MCR Health. And part of that is because we are highly grant funded, because we spend a huge amount of money, because our grants are from HUD for rental assistance, which is a large pot of money. MCR Health was just saying they get a large amount of grant funding. So you have to be really careful about how it fits, because it wouldn't fit every agency in one uniform way. And again, that's because we get huge amounts of pass-through dollars. So of the millions of dollars that I get for rental assistance, a tiny fraction actually pays salaries and or overhead. So much so that we have to go out and seek those dollars elsewhere, and we have some grants that are 100% pass through to the client only for rental assistance. 100% of the grant is for the client. And so you have to be really careful in looking at that. And also, I think overhead comes up a lot. I am the first one to say that we should be investing dollars into our employees, into our infrastructure, and overhead is important. We have probably one of the lowest overheads out there, but it's not because I'm not investing in my infrastructure. It's because of those pass-through grants. Those pass-through grants that give us no dollars, so we have a large amount of money coming in that really can skew overhead. So again, it is not a simple process. My overhead can be, our overhead's been 8% and lower, which is very rare. And often that means that that agency isn't investing in employees' salaries, investing in infrastructure, you're using ancient technology, things of that sort. But again, just because of the nature of how our funds come in, that is not the case. We get such high pass-through dollars. So I just caution you, as you look at it, it's not going to be very easy to come up with a cookie cutter, what is financial stability.
District 1 School Board Member Heather Felton, welcome to Manatee County Board of County Commissioners.
Thank you very much. So obviously, yes, District 1 School Board Member. I'm also a member of the Children's Services Advisory Board. And I can assure every member of this commission that we look at where are they getting their funding? What percentage of funding are they looking at to receive from us? What is the effect? How many people are they affecting through their programs? We have very rigorous process that they have to go through and answer many, many questions. And it takes hours for us to go through this, and Commissioner Ballard is nodding because she's watched us do it. And we have very robust discussions. It's not just we come up with a score and we give them money. We come up with scores and then we sit there and debate, what are the things that we feel like this nonprofit does. Is it deserving of the full amount of funding that they need? What concerns do we have? We listen to staff who go and visit all of these nonprofits and they bring us reports back. So we put a lot into it. And you can talk to any one of us anytime, give me a call, you know how to reach me, and I will walk you through, I'll show you the massive binders that we have full of our applications, how we go through every single one of them and talk about every single one of them. And once we get to 3 months through of talking about these, then we go over the scores. We don't have a B list. We have a list. And every single one of them is on that list. And do they need the full funding? Are they meeting the requirements? Is this a brand new nonprofit that has no background, no results to show us? We talk about all of those things, and it takes hours and hours and hours to do it. And any one of us will be happy to walk you through that process, show you how we decide this. And even if we have enough money to 100% fund all of them, it's taxpayer funds. We are very aware of that. And if we feel like, nonprofit B has never been established, they have this grandiose plan, but they're only going to be able to serve 5 people, maybe we need to, step back on that one. And we won't recommend that one. Let them get their feet wet and show us why this nonprofit deserves this full amount of funding. So I just want to assure everyone here, we are very, very aware of the fact that this is taxpayer money. We don't want to waste it. We want to make sure that the people who are getting this funds are doing absolutely everything they can to help our children. We're very invested in it. And again, any one of us can speak to that. And please bring questions to your briefings. Any one of us will show up and answer them for you. Thank you.
Hi, my name is Connie Shingle-Decker, and I am a CSAB board member, and yes, I am a resident of Manatee County. First, I want to thank you for the privilege of being able to serve on the Children's Services Advisory Board. This is my second time around. I knew what I was getting into, and I still agreed to do it. It's probably one of the most difficult, time-consuming boards, and I don't know how I did it when I was working full-time at the Sheriff's Office. But just to speak to some of the comments, Commissioner Cruz, thank you so very much for your comments, because you're right on point. You have to trust the process. And if you find that there is a problem with the process, then we need to work to fix it. We have an opportunity when we are going to meet together for our retreat to sort of work on some of what we think are some of the issues that come up through the funding process. But I will tell you, when we are going through the funding process and we've already scored and now we're going to sit down and we're going to discuss them, we talk about everything that has already been discussed today. What are the opportunities that this particular program has to even be able to go out and seek funding? I'll give you an example of one program that probably isn't going to get any funding even if they try to, and that's a juvenile sex offender program. So we know that chances are it's not a very sexy program that someone's going to say, yeah, I want to dump a lot of money into that. I mean, this is juveniles that have committed sex offenses, and it's an extremely good program. It works. And so we look at the fact that they probably aren't going to be able to fundraise to support themselves, but how necessary that program is in our community and the good work that it does. What is their success rate and how they're able to show us what that success rate is. If the nonprofit or if that program comes in and sits, when we're talking about that particular program, they're going to get to hear from us the good things that we have to say, what we like that they are doing, and then what we think they could improve on. Even their application process, we will give them suggestions during that time period about how confusing your process was, how we didn't really understand it, and had we had more information on X, Y, or Z, we would have had maybe come up with a different outcome. We listen to each other, and sometimes we change our mind when we hear, and at the very end, when that program has an opportunity at the end to speak, we can't talk back to them, but we're listening to what they're saying, and it may make a difference when we actually vote, because we have that open opportunity to hear from them before the final vote. So the process is an extremely good process. Is it frustrating at times when we see that the county commission is overruled and maybe decided? But we are only an advisory board, and we understand that. But we appreciate so much the opportunity to interact with you all, to answer any questions that you have. We are thrilled when Commissioner Ballard is there, because she gets it. Thank you all so much.
Good morning, Commission. John Agnelli, Boys and Girls Clubs for Manatee County. You know, we're entering our 80th year in the county this upcoming January 1. I want to answer some of the questions. I know, Jason, you had some questions. Commissioner Bairden, you had some questions. We're getting 25% of our funding from the county, 11% from the state, 64% from foundations and grants. It's not always easy. The question was, you know, why do donations go down? Well, I know for us, Hurricane Milton impacted folks' ability to give us, you know, donations because they had so much other stuff to take care of. Sometimes people pass away. Those things will impact and decrease donations. We know that we're serving about 2,500 young people each year, but we also know there's 54,000 kids in this county. We also know that for every $1 that it's invested, based on the analytical, the return on investment for the county is $10.32 per every dollar, which is about $14.9 million. You know, where our challenge has come in, as we know, is, and I think there was a piece about planning and making sure that we're thinking about those future revenue streams. And when we look at the opioid settlement money, we've always gotten that money from the state, for example. And then, you know, we had a month's notice that the state wasn't going to be funding opioid prevention and education. So they sent us down to the county and directed us and advised us, you know, through leadership to come down. But we also know that the county's been very supportive. Just Monday and Tuesday alone, we must have given out 200 boxes of Narcan. We educated how many parents and family members, because that's the partnership that's so important. We could not function without the county. We could not be a part of this community without the county. The county has done some significant things for us. And I know that there was more pressures coming. I hear Commissioner Feltz all the time. You know, we need to get something up in parish. We get it. And I continue to challenge, you know, Commissioner Feltz to put the pressure on us to continue to look at that parish location, because there should be that opportunity and service that we're doing out there. We know that the stuff that we're doing is working. We believe this is where great futures start. Our mayor of Palmetto, our mayor of Bradenton, Senator Boyd, Mr. Ron, all club kids, all started in that process and that journey, so we know the work that we're doing. And the outside fundraising, you're right, those events are important. And what we do, I think, is impacting the lives. We know that 21st Century in the next fiscal year is not in the budget at the federal level. Dawn is not going to let us just sit there and say, well, we're just not going to help anybody. It's just not an option. Like, we got kids in Title I schools for after-school programming that we have to start planning now, as we almost had to when the budget got frozen and then the funds were released. She was already working on making sure that we had another alternative for those young people. You know, we've got a lot of kids that don't go to after-school care because they don't have the opportunity to do so. And so, you know, while we talk about things like galas and stuff, of course, we have our golf outing September 21st, November 21st, our tree lot, and our gala will be April 11th at the Marriott. We look forward to seeing you all there.
Sorry. Runway. Xtavia Bailey, Chair, Children's Services Board. I just want to say to the commissioners, Commissioner Cruz, thank you. I know you get tired of me calling in your ear and talking about children's services and the process, and Commissioner Ballard. And I want to answer a couple questions. When we talk about consideration, the low score indication of poor programming, and best use of funds, best use of taxpayers' money. So it's not just two of us, it's not just three of us, it's 11 of us on this board. So there's a scoring process. So we do the budget. We go through the budget. When I was first on the board, we went through the entire budget. But we're looking at the budget, and we're also weighing how much money is being funded by the county. So if they're 100% funded by the county, they're going to get a lower score. It doesn't mean that they're going to have a bad application, but if they're getting other resources, they'll get a higher score. So when we talk about B, I don't know, Commissioner Ron, if there's a B, but I think there's a process where when we vote, sometimes we vote so close that may be something that you all may want to consider if someone approaches you, and we voted very closely, where it's like a 6-5 vote, and it would have passed if it was a couple extra votes. And the weighted, we had Mayaca, Rabonia, and Talabas. Those are particular programs and communities where they have to have some type of service out there, and it's usually a service we use. When I first got on the board, we used to heavily weight these particular communities because there were no others, so they got extra support. But the financial part and the process, I personally think, being on the board, this is my 11th year. This is my third time as chair, and I think that CSAB has the sauce. I think we've worked really, really hard. Yeah, I think so. If we look at the application and how we weighted, we make sure that we're doing the best to make sure that we're giving opportunities to every single program. Of course, there's going to be programs that are going to come back, and you can send them back to us. And most of the times when you do send them back, we do review them, and then we go ahead and recommend. And once it gets to the staff, like Commissioner Ron said, the staff is able to help them. They just can't help them with the application. So we look forward to working with you all on the briefings. And if you have any questions, we are here. Thank you for all you do.
Good morning, Commissioners. I'm James McLeod with Genesis Health Services, and I'd like to speak a moment about adult services funding and the dental field. And I don't know if this comes under the emergency, but our dilemma is this. This year, we again made application for funding for dental program to provide comprehensive dental services upon referral from Turning Points. Services such as crown and bridge, root canals, wisdom teeth extraction, bone grafts, the more complex procedures. But we're able to provide those procedures at a fee level that the ALIS population can help support. and thereby making comprehensive dental services available for people that don't usually get it. Our proposal scored low because I truthfully answered a question about what would be our results. And I said that 50% of the people that received these appliances would complete their treatment plan. And evidently, whoever scored us did not know that currently among this population, you're lucky to get 10 to 15% of the people who see us complete their treatment plan to the end. They're usually episodic customers. They come in when it hurts. So we scored low, but nevertheless, our proposal was really for a dental laboratory. We wanted to start providing our own dental appliances because the emergency comes in wherein we have to send our cases to get the lowest cost for dental appliances to the East Coast of Florida, who in turn sends it to China. So we've been getting Chinese products for the last 5 or 6 years because they are the least expensive. That's no longer the case. If we have to pay prices from current laboratories available, our product would be unaffordable to the Alice population. So we want to make our own dentures, and that was what our proposal was for. We was asking the county for funding to help with operations, and then Genesis would come up with about $150,000 of equipment to do our own laboratory. We got a memorandum of agreement with Turning Point to provide free services to their clients in monthly numbers, even including implants, because we would be making our own implant crowns. Thank you.
I would just say, you can email all of us and have conversation about this. Seems like a bigger discussion than what you
Sure.
can squeeze into 3 minutes, so.
No problem.
Feel free to reach out and try to set up meetings or Zoom calls or whatever.
Thank you very much.
Good morning again. I'll make it brief, but I didn't want, Janet Pierce, Children's Services Advisory Board, Vice Chair. I didn't want the opportunity to pass without saying thank you for the honor of serving on this great board. But also, I just have to recognize Tracy, Christy, and the team. We are a demanding board. We are a demanding board, and we, as you've heard, we spend a lot of time in meetings. We look at a lot of data. We have a lot of conversations, and somehow they capture all of this. So when it comes to decision time, they're able to say, here's what you said, here are the pluses, here are the negatives. They're amazing. They are absolutely, we couldn't do it without them. So I just wanted to say and recognize their great work. And I hope you guys do. Thank you so much.
Are any other public comments? Seeing none. There's no non-commissioners on the board there. Those are all panelists. There's no call-ins, correct? No. Okay. I will close public comment. Any final, Tracy, anything from you? Is there any closing remarks or wrap up? Or if not, I can just, no? Okay. Commissioner Ron, do you have anything?
I'd just like to thank you guys for the great work that you do. I know you're a demanding board. We know who your chair is. So, you guys, across the board, this is so important to Manatee County, this, health and human services. We don't take it lightly up here at all. I mean, this is something we believe in, the board believes in it, and we want to find out the best processes that we can go through to serve all the residents in need of Manatee County. But just thank you again. Our staff is wonderful. We know that. They do a great job. We hear from them all the time, believe me. Just thank you again for all the hard work you guys do. We really appreciate it. And that's it, Mr. Chair. Thank you.
All right, thank you. Commissioner Ballard?
Yeah, I'll just echo Commissioner Ron's comments. The amount of time that Children's Services Board spends on these applications, not just in meetings, but also in the review outside of meetings. I mean, it is immense, and we really do just appreciate all of the work that we do. We appreciate all of the work that staff puts in, both in Children's Services and on the Health and Human Services side, because I know that the scoring process, going through all these applications is very, very difficult, and also just thank all the nonprofits that are out there doing the good work as well. So, thank you.
Commissioner Sadiq.
Thank you. I'll echo a lot of those comments, and I appreciate the work of our volunteers on the board as well as the work that the nonprofits are doing that presented today. I think some things I hope to see in the future from this board. One, I think the one word I didn't really hear today much spoken too often was the word strategy, and I think we as a board owe it to the Children's Services Advisory Board and the nonprofits to make it clear what our strategy will be to address unmet needs in the county. I think that's probably the most broad way to describe it, because with Medicaid, Medicare cuts, might be mixing those two up. The increase in the ALICE population year over year, looking at the past several years, not to mention the increase in volume that our first responders, EMS, and fire districts are seeing for basic things that are not emergencies, like headaches to anything that primary care doctor might see. We are going to see a meaningful increase in those types of calls and a strain in our public resources. So I think we owe it to the public to come up with at least some notion of a strategy for what needs we want to focus on outside of what CSAB does, but certainly inclusive of that. So I hope to see that from our strategy conversations. And again, I'd just like to echo what the other commissioners said and thank everyone in the room for the hard work they're doing there.
All right. Any other Zoom-based commissioners have anything to say before we adjourn? Commissioner McCann, Commissioner Feltz, Commissioner Bearden. Nope. All right. Well, seriously, thank all of you for coming. Our nonprofits are important. You do the work that government can't do. And, we're here to support each and every one of you across all of these different buckets. Again, it's just a matter of there's a lot of tough decisions that have to be made. And, but we try to make them to the best of our ability for the best outcome for the citizens of Manatee County. Not all of you came up to speak, and I'm looking out and seeing some groups that didn't speak, and it was, probably here just to listen to what we had to say. But I would encourage you after to reach out. Like, unfortunately, it's been on my to-do list for probably 2 months, but I've been meaning to reach back out to Ink. I know we spoke at Xtavia's Multicultural Festival a couple of months ago. So, I'm the chair of the Health, Safety, and Justice Board for Florida Association of County this year. So I'd like to talk to you more. So reach out. All of us are accessible. So if there's something you want to talk about and maybe you didn't get funded this year, or you have a question about how to get a little bit more into the process, or maybe there's somebody we can introduce you to help expand. I mean, we're more than happy to use our connections, our contacts, and whatever we can do to help all nonprofits. Sometimes it's through funding. That's obviously the easy way. But sometimes it's just through connections and advocacy and assistance in any way we can. Working with you on an event you're having or trying to make the right warm connection. So reach out to all 7 of us up here. We're always happy to help anybody in any way we can. So again, thank you all for your service. Thank you, School Board Member Felton, for attending today. And if there's no more further comments from this board, or Pam, Courtney, you good? All right, then we are adjourned.